Hello and welcome to Lit Fitness. My name is Christopher and I'm a doctor of physical therapy. On my channel, I talk about different injuries and the recovery process that goes along with them. In today's video, we're going to be talking about knee replacements and what things look like several weeks after. If there are any other injuries that you'd like to learn about, leave me a comment down below and I can make a video helping to describe what goes along with it. Recovery from a knee replacement is typically broken into a few discrete chunks. So the first is obviously you had the surgery. Then for a couple weeks thereafter, you end up with, in a lot of places, home health physical therapy, where somebody comes in and their primary goal is to help teach you what to do to get things moving, keep an eye on the incision, and help you get up and around more easily and show you different ways to adapt. After about 2 weeks' time, you'll come to an outpatient physical therapist like myself, where my function in your recovery process is now to increase your range of motion, your strength, and help you get back to doing the things that you were doing prior to this surgery. So it tends to be a longer process. We're looking around the 4 to 8 week mark on average. Some cases can go a little bit longer, some a little bit shorter. It just depends on how well your body responds to the procedure. Now, I will also help keep an eye on things like your incision to make sure there's no signs of infection, make sure things are progressing nicely. We'll take measurements every couple of visits to make sure that our motion is coming back and that we're not getting anything to go backwards. I'm also there to help answer any questions that you might have regarding your process and help to kind of guide you in your function and help push you a little bit farther or decrease things if you're having an increase in pain. Now, range of motion goals tend to differ from surgeon to surgeon. I personally typically see around the 120 mark as the number that surgeons always push for. Now, that's great if we can hit 120. A lot of people do, not everyone does, so if you don't be discouraged. I always help to get my patients as close to the 125 mark as we can, because if we can get 125 comfortably, then that gives us some leeway if things start to tighten up and you lose a little bit of motion. I also find that helping to get things as straight as possible, as soon as possible, is beneficial to help normalize the walking gait and decrease the amount of hip pain and lower back pain that you'll have throughout the recovery. Now let's take a look at some anatomy to see what they're actually doing when they go in there to replace your knee. All right, let's take a look at the anatomy of a healthy knee and then look at what it looks like after they've done a knee replacement. So here on the left side of this diagram, we can see a healthy knee. We've got our femur here, which is our thigh bone. We have our tibia, which is our shin bone. We have our fibula, which runs alongside the tibia, and the bottom part of it forms our outside part of our ankle. And this diagram also shows us a kneecap, which slides in along this blue section right in here, which is our articular cartilage that's on the bottom part of our femur. So this cartilage here interacts with the articular cartilage and the meniscus here on the upper part of our tibia to help form a nicely moving, pain-free knee. Prior to your operation, you probably had a few x-rays and the doctor probably told you that you have arthritis, which basically just means that those surfaces are not as smooth as they once were and now become painful when you do any weight-bearing activities like running, squatting, stairs, sit and stand from a chair, that sort of thing. I don't need to tell you that. You already know, and that's why you clicked this video. So we've got the bones and the articular cartilage there, and this diagram also did a nice job of showing us the ligaments of the knee. The first one is our LCL that sits on the outside of the knee, MCL that sits on the inside part of the knee, and then we have our ACL and our PCL. These ligaments are important for making sure that our knee stays together and moves the way that we are supposed to move. So, all that being said, let's take a look at the total knee replacement side. The first thing you'll notice is, one, you've got these prosthetic parts that are going to end up going inside of the knee. Now, this upper part that goes on the femur, or your thigh bone there, will slide up in nicely onto the femur once they get things appropriately cut. So this will help to make it so that articular cartilage is not there anymore and is not causing you any pain. Then they do a similar technique to plane off the bottom part of this tibia and give you this new prosthesis to put on there, so again, you don't have any painful areas in your knee. Yes, that does mean that you no longer have a meniscus, and if you are Looking real close, you also see that we're missing this X that's in the middle from our ACL and our PCL. There are some surgeries that will spare the PCL and the ACL. They are less common because most of the time we don't need then our ACL, and that stability of the leg going backwards can be provided by the prosthesis, and we don't need our PCL any longer either. Then you'll notice that we still have our MCL and our LCL here to provide the stability for lateral motion of the knee. Sometimes you'll get to keep your original parts and pieces in your kneecap. The bottom part of it can sometimes become uneven and cause pain and grinding sensations in the knee. If things look healthy, then they'll leave the bottom part how it is. Otherwise, they call it doing a button. They could put a synthetic material on the underside of your kneecap to make it so it's not painful either when you're moving around and kicking your leg out and putting force through that knee. If you found this information helpful, please leave a like and subscribe. And again, thank you for watching, and we'll see you next time.